Cystic fibrosis, or CF, is a serious illness passed down through families. It affects how the body makes mucus. Now, mucus is a slippery substance that keeps our organs wet and protects them. But in CF, mucus becomes thick and sticky. This sticky mucus clogs the lungs, pancreas, and other organs. CF mainly affects the lungs and the digestive system. The thick mucus blocks the airways in the lungs. This blockage makes it hard to breathe and can cause lung infections. The mucus also affects the pancreas. The pancreas makes enzymes that help us digest food. In CF, the thick mucus blocks these enzymes. This blockage makes it hard for the body to absorb nutrients from food. People with CF have a variety of symptoms. They often have a cough that won't go away, lots of lung infections, and trouble breathing. Digestive problems are also common. These problems can include not gaining enough weight, greasy poop, and tummy aches. While CF is a serious illness that lasts a lifetime, treatments have gotten much better. With the right care, people with CF can live longer, healthier lives. Cystic fibrosis is caused by a problem with a gene called CFTR. Genes carry the instructions for making proteins. Proteins do important jobs in the body. The CFTR gene makes a protein that controls how salt and water move in and out of cells. A mutation or change in the CFTR gene causes CF. People with CF inherit 2 copies of the mutated CFTR gene, one from each parent. If a person inherits only 1 mutated copy, they are a carrier of CF. Carriers don't have CF themselves, but they can pass the mutated gene to their kids. CF is an autosomal recessive disorder. This means that a child must inherit 2 mutated copies of the CFTR gene to get CF. If both parents are carriers, there is a 25% chance that their child will have CF, a 50% chance that their child will be a carrier, and a 25% chance that their child will not inherit either copy of the mutated gene. Cystic fibrosis causes lots of different symptoms, and how bad these symptoms are can be different for everyone. Some common symptoms of CF include breathing problems like a cough that won't go away, wheezing, shortness of breath, frequent lung infections like pneumonia and bronchitis, thick mucus, and coughing up blood. Digestive problems can include slow weight gain and growth, even with a good appetite, greasy and bulky poop, constipation, tummy aches and cramps, and delayed meconium passage in newborns. Other symptoms might be salty-tasting skin, lots of sweating, tiredness, men not being able to have children, and nasal polyps. It's important to remember that not everyone with CF will have all of these symptoms. Some people may only have mild symptoms, while others may have more serious symptoms that need a lot of medical care. Finding and treating CF early is really important for better health and a better life. Newborn screening is now done routinely in many countries, including the United States. This screening test measures the level of a protein called immunoreactive trypsinogen, or IRT, in the baby's blood. High levels of IRT can be a sign of CF. If the newborn screening test is positive, more tests are needed to be sure it's CF. The most common test is the sweat test. The sweat test measures how much salt is in the sweat. People with CF have more salt in their sweat. Genetic testing can also be used to diagnose CF. While there is no way to get rid of CF completely, there are many treatments that can help manage symptoms and improve quality of life. Treatments for CF include medicines like antibiotics to prevent and treat lung infections, bronchodilators to open up the airways, mucus thinners to make it easier to cough up mucus, and CFTR modulators to help fix the broken CFTR protein. Chest physiotherapy involves techniques to loosen and clear mucus from the lungs, such as percussion, vibration, and postural drainage. Nutritional therapy includes a high-calorie, high-fat diet to help with weight gain and growth, pancreatic enzyme supplements to help with digestion, and vitamin supplements to correct deficiencies. In really bad cases of CF, a lung transplant might be needed. A lung transplant is a major surgery where damaged lungs are replaced with healthy lungs from a donor.